What did you say wrong with you?
Well, I was diagnosed with fibromyalgia.
Oh, fibroids.
No, not fibroids. Fibromyalgia.
Right, bacon chuka. You hungry?
No, fibromyalgia.
So why you cussing my mother? If you don't want to tell me, just say it.
Hello, chronic illness warriors. Welcome back to my channel. I'm Janine and I make lifestyle videos for Black women who suffer from chronic illnesses like me. So in today's video, we're going to talk about one of my chronic illnesses and the most major one that's really kicking my ass right now, fibromyalgia. But before we continue, don't forget to subscribe to my channel by clicking the subscribe button down below and click the notification bell next to it so you'll be notified every time I release a new video. So I've been living with fibromyalgia for the past 4 years. So this video is just gonna go through what it is, causes and the symptoms, and how my life has been affected since being diagnosed with fibromyalgia. So fibromyalgia is a disorder of the nervous system that causes widespread musculoskeletal chronic pain and fatigue. Musculoskeletal pain refers to pain in the muscles, ligaments, bones, and tendons. So with a normal body, when you get sick or injured, nerve signals travel from the injured area up the spinal cord and into the brain. And the brain senses these signals as pain. So what this means is that your nervous system knows that something is wrong. And when you heal from the pain will gradually lessen until it's gone and you have no more pain. But with fibromyalgia, the pain never goes away if you're sick or not. So according to WebMD, basically fibromyalgia is a glitch in the nervous system, which affects the way your body processes pain signals. So of course, we want to know what causes this glitch in the system. But nobody knows. Just like many illnesses out there, you've come to realize that nobody really knows the causes of these illnesses. They just happen. But some of the main factors that contribute to this illness are genetics. Apparently, fibromyalgia runs in families. So I asked both sides of my family if anyone suffers from fibromyalgia, and they said no. So I guess that means I'm adopted. So you can inherit genes that causes chronic pain. I need to talk to my father. So the next factor is gender. So surprise, surprise, fibromyalgia affects women more than it does men. I think this is especially noteworthy in the Black community because, of course, women are taught to just hide all your feelings and be strong, put on a brave face, and carry the whole world on your shoulders. Any pain, emotional or physical, that we feel, we keep it bottled up. The next contributing factor is infection. It is believed that viral infections like the Epstein-Barr virus or the Guillain-Barre virus, I hope I pronounced that correctly, cause fibromyalgia. Now apparently the Epstein-Barr is a very common virus. So one of the tests I actually had to do to determine if I had fibromyalgia was the Epstein-Barr virus test. So it's a simple blood test to see whether you had it previously or if you have it right now. And I actually tested as having had the virus at some point in time. Like a year before I was diagnosed, I kept on getting cold symptoms. So this was not very normal for me, someone like me who doesn't get every single cold that passes. But that year, I just kept getting sick all the time with flu-like symptoms. And everyone was wondering, what's going on with Janine? I realized that it probably wasn't the cold and it could have been this Epstein-Barr virus. The next contributing factor is anxiety and depression. So I have had these two illnesses for a very long time. Didn't really disclose it to anyone. And even though they are contributing factors for fibromyalgia, they don't really know, doctors don't really know how they contribute to fibromyalgia. But again, I'm not a doctor, but I believe that they do contribute to fibromyalgia because, especially for depression, depression is caused by a chemical imbalance in the brain. But actually, that could be one of the causes, a chemical imbalance in the brain. And saying that fibromyalgia is a disorder of the nervous system and the brain, I believe that depression especially is a huge contributing factor to fibromyalgia. The last contributing factor, and the main one for me, is emotional or physical trauma. So you might have been involved in an accident, or you had a bad fall, or you may have suffered an emotionally traumatic experience like the death of a loved one or some kind of assault. These traumatic experiences are believed to bring on or trigger fibromyalgia. There are even some doctors who believe that dormant trauma, like something suffered as a child, like a bad fall or death of a loved one, remain dormant until later on in life when you experience another traumatic event, which then triggers fibromyalgia. I definitely believe that my mother's illness and death was the traumatic experience that triggered fibromyalgia. And also, I suffered a bad fall when I was about 9 or 10 years old. I landed on this arm, but it healed up because at that age, things heal up very quickly. So I believe that those two events in my life triggered the fibromyalgia. So the thing with fibromyalgia is there is no one test or one symptom that could easily determine what fibromyalgia is. Diagnosis is a process of elimination. You will have to do different blood tests, scans like x-rays or MRIs. And once these tests show that you don't have any other illness like rheumatoid arthritis or lupus or just anxiety or depression, because anxiety and depression can cause widespread pain as well. But once they start to rule out all the different symptoms based on all the tests you have done, then fibromyalgia would be the next logical diagnosis. So what are the symptoms of fibromyalgia? First symptom, of course, is widespread pain. For the pain to be considered as part of fibromyalgia, you have to be experiencing widespread pain throughout your entire body for more than 3 months. The pain has to occur on both sides of the body, above and below the waist, to be considered as fibromyalgia. The strange thing with me is that I get more pain on the left side of my body than the right. So if I'm in a flare-up or I'm having a lot of pain, the pain is mainly on this side. So on this shoulder, this hip, this leg. If I get a headache, I'll get it on this side of my face, especially around the eye area there. So in the early days, fibromyalgia was determined by testing 18 tender points in your body. And if you got pain in 11 out of those 18 points, then they said, well, you have fibromyalgia. But they don't really use that test anymore. They just go with the 3-month time period of pain to determine if you have fibromyalgia. Even though the tender point test isn't used as a definite fibromyalgia diagnosis, the same points that were mentioned are what they look for to see if you have fibromyalgia. So at the base of your head, your shoulders, base of your neck, your hips, your lower back. Once you get pain in those areas, they determine that you could possibly have fibromyalgia. The next symptom is fatigue. When your body is in pain or it feels ill, automatically it's going to try to find ways to relieve the pain or to make you feel better. But since the pain doesn't go away and you don't feel better, the energy that your body has to put out to feel better causes you to get tired. So fatigue is, next to pain, one of the biggest symptoms of fibromyalgia. And it's not just normal fatigue like a normal person would feel after a hard day's work. They would just go to bed and sleep it off. With fibromyalgia, even if you get a full night's sleep and you take naps during the day, you're still going to wake up feeling as if you didn't sleep in days. So the next symptom is cognitive difficulties, also known as fibro fog. Again, your brain and your nervous system is not functioning properly. So sometimes you'd have trouble concentrating, or you might forget what you were saying in the middle of a conversation. That happens to me a lot. Sometimes you may even forget the name of an item, something as simple as a roll of thread. Another aspect of fibro fog that I experience especially is clumsiness. Now, I've always been clumsy. I've been told that many times. But 4 or 5 years ago, I started noticing that I would just be bumping into things where there was a huge space between me and the object, and I'd still bounce into it. And I remember asking myself, why do I keep bumping into things more than normal? When I was diagnosed, I realized that was part of the cognitive difficulties I was experiencing. So another symptom is insomnia. If you're in chronic pain, your body will find it very difficult to rest because it's in pain. And you also experience issues with staying asleep. So you might be able to fall asleep, but then you find yourself waking up 2 or 3 hours during the night, which in turn leads to fatigue because your body didn't get a full night's rest and you wake up the next morning feeling tired. The other symptoms you experience are anxiety and depression. So we talked about that earlier as one of the contributing factors, but it's also one of the symptoms. So it's like a never-ending cycle. Anxiety or depression causes fibro. Fibro causes anxiety and depression. So even if you have never suffered from depression before, you will get depressed because your whole quality of life has changed. And depending on how severe you get it, you might be able to do the things you were accustomed doing, and you might lose some of your independence, which will cause depression. In terms of anxiety, since we're always in pain, you're always going to be wondering, when am I going to get another flare-up? Will this affect my daily life? Or sometimes, again, you might have made plans to go somewhere, and then on the day of the event, you have to cancel because that day your body is on a total flare-up. So those are the main symptoms of fibromyalgia. But you think that was it? No, there are actually more. These symptoms are irritable bowel syndrome, or IBS. That's basically stomach pain, nausea, constipation, or diarrhea. And again, the brain is not functioning well, so it affects the way your stomach deals with food. Headaches or migraines, sensitivity to cold or heat, and another symptom called allodynia, which is pain caused from items that don't normally cause pain. So like if somebody just touches you like this, or sometimes even your clothes. So when you're having bad pain, sometimes even the clothes that you're wearing causes pain. Depending on who you are, you might get some of the symptoms and not all of the symptoms. Or if you're lucky like I am, I get all of them. But there is hope, and even though there is no cure for fibromyalgia, there are things we can do to make our life bearable and more manageable. So I'm going to deal with that in another video, but I hope that this video was informative and it helps you to better understand fibromyalgia. If there's anything that I left out, or if you just want to leave a comment in general, you can leave a comment in the comment section below. And also give this video a thumbs up if you liked it. And please, of course, share with anyone who you may know who's experiencing similar symptoms. Or if you know someone who has fibromyalgia, you can share this video with them to spread awareness. So don't forget to subscribe to my channel. So I'll see you in my next video. Bye!